welcome. This is Pam. Today we're going to be talking about roundworms in multiple sclerosis, large roundworms in multiple sclerosis. So this is part 4 of a series that I'm doing, and it's called MS is an Infectious Disease, part 4, large roundworms in multiple sclerosis and other diseases. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago, and by the grace of God, I learned early on that MS is an infectious disease caused by a parasitic infestation. And over the years, we've learned a lot about the types of parasites that are involved with multiple sclerosis. And today is part 4. So MS, unfortunately, it's not like we're just dealing with one type of parasite. And so it's really important to understand what we're dealing with, because that's the only way that we can recover. And people are recovering. The wellness champions are recovering from multiple sclerosis and other diseases by treating the cause, by treating the parasites that are causing disease. So again, we've talked about MS and fungus, MS and Lyme disease, MS and filarial worms. Today is MS and large roundworms. And it's not just people that suffer with multiple sclerosis that commonly have these large roundworms. Other people that have, and we're going to talk about that. So maybe you're a healthy person, maybe you know somebody who has MS and you're just watching this because you care about your loved one or your friend, but you might have some symptoms of parasites that you're not aware of, and roundworms are really, really common. Another reason this topic is so important is that over the last few years, like in particular 2020, a study came out saying that roundworms were immune modulatory for MS patients. So they're a good thing, certain types of roundworms, and those were the hookworms. They infected MS patients with hookworms, and they said that because these worms produce immunosuppressive molecules or substances that suppress the immune system, that is a good thing, because in MS, the immune system is attacking itself for no apparent reason. And so this might open the door for new drugs if we can figure out what the different substances that these roundworms are producing that would suppress the immune system. They're hoping that they could patent drugs. So this is all for new medications. And that's not what we want when we're diagnosed with MS. What we want is we want a cure. We're looking for a cure. And unfortunately, they're not talking about cures these days, which is really, really sad. So this study, the 2020 study, they looked at the impact of infecting MS patients with hookworms. And they concluded through their study that it didn't really make a significant difference in the MRI imaging in the lesions, like the more or less lesions that the MS patients had, and that was pretty consistent with other studies. So unfortunately, this research that came out, it really turned people away from even looking at the possibility that MS is an infectious disease or MS is caused by parasites, because they're like, oh, well, there are studies that have been done that show that MS is good, that worms are good for multiple sclerosis, and nothing could be further from the truth. You're going to see we're going to talk about the symptoms they cause and how they affect us with multiple sclerosis, and of course, how to treat them. And I'm going to share with you some pictures. Hopefully you can stomach them. I know that for a lot of people, you don't really want to look at them, but trust me, it is a game changer when you really understand what they look like, because you probably have some roundworms living inside of you. It's super, super common. So again, this research really sent people away from looking at the truth, which is really unfortunate. So we know that different types of, like even the hookworm, so the one that they infected MS patients with, we know that it can cause anemia and itchy rash, a cough, a wheeze, trouble breathing, abdominal pain, weight loss, diarrhea, and loss of appetite. In children, can really affect their growth and impair their mental development, so physical and mental development. So these are not something that we want to have in our body. These are definitely something that we want to get rid of if we do have them in our body. And so if we look at the all those symptoms. And then we just really have to ask ourselves, like, sure, these roundworms, they might suppress our immune system, but we have been suppressing our immune system with all kinds of chronic diseases for so many years. And how are we doing? Like, tell me the quality of life that you have. Like, are these drugs working for you, these immunosuppressive drugs? Is it a good idea to look for some more immunosuppressive drugs just from maybe substances from worms? I don't think so. It's not giving us the quality of life that we want. So if we look at the world of roundworms, another word for roundworm is nematode, and they are one of the most abundant, they're considered an animal in the world. They are parasitic to animals and plants. So some of them will be parasitic to plants and some will be parasitic to animals. And they can range in size from just microscopic, you need a microscope to see them, to 23 feet long. They can infect all organs in the body, but they are commonly found in the intestines, the circulatory system, and the respiratory system. So in our, like the heart, the blood vessels, but also in our lungs, etc. So roundworm examples could be hookworms, lungworms, pinworms, threadworms, whipworms, filarial worms, and ascaris worms. Those are just a few different types of nematode roundworms. So they are parasitic, meaning they live in our body and they cause us harm. All right, so a parasite is any microorganism that lives in our body and causes us harm. So we're going to talk about in future of this series, we're going to talk about Babesia and Borrelia, which are bacteria and protozoa. They're parasites. Also, worms are parasites. Fungus can be a parasite. So anything that lives in us and causes harm. And today we're talking about the larger roundworms. We talked about the small filarial nematodes in a previous, and that was a really important find that Dr. Alan McDonald discovered. So if you haven't learned about that, make sure to listen to my previous video and go to our website, livediseasefree.com. You'll see the blog post there. MS is an infectious disease. I don't know if it was part 2 or part 3, but MS and filarial worms. And today it's MS and large roundworms. So again, the ascaris worms they can be really large, and they're a roundworm. And they live in the human small intestine. And it's really, the things I'm sharing with you are really important to know when you want to treat them and recover from them, because you have to understand, like how big are they? Where do they like to live? Where do they like what parts of the body do they like to infect? What's the best treatment? How long is their life cycle? Which drugs treat larva and adult forms, etc. So all of that is really important because it helps us to make a more effective treatment plan. And so these worms, they can grow up to over a foot long. Longer than a foot. Like, I have seen many pictures from my students where they're over 2 feet long. They can be as thick as a pencil. Quite often they look more like a spaghetti, the thickness of a noodle. And a person can have over 100 roundworms inside of them. They can be infected with them. And you think, no, that's not possible, Pam. They'd be dead. Well, I have students telling me all the time, and healthcare professionals that are recovering from chronic diseases caused by these parasites. And one just last week shared with me, and she's a healthcare professional, and she sent me a bunch of pictures. And she said, Pam, I have passed at least 200 parasite worms in the past 3 treatment cycles. And she went from not being able to function, she can tap dance again. And that treatment cycle is about a month, maybe 4 to 6 weeks. So like in 3 treatment cycles, she's gone from not functioning to being able to tap dance again. And can you imagine what kind of a practitioner she will be? Because she's been there and done that herself. She has suffered. She had a neurological condition. And so I'm really excited. And unfortunately, like, we need to get more practitioners. We don't want to just help sick practitioners, but we also want to help practitioners that are healthy so that they understand what's going on in their patients, like the parasitic load that their patient is carrying. We're going to talk about things that are going to be really helpful for you in this video. because that's really important, is that a lot of practitioners, they're starting to become aware of parasites and they're starting to be interested, but they're just not treating effectively enough yet. So it is very possible to have at least 100 or more worms in us when we feel horrible, like when we feel really, really sick, maybe when we have chronic disease label. Also, these female worms can lay up to 200,000 eggs in one day. It seems a little daunting, doesn't it? And it takes about 2 to 3 months for the ingested egg, so when you swallow the egg, to develop into an adult worm. And the adult worms live about 1 to 2 years. So it depends on the species, the type of worm. Again, some can be microscopic, so you need a microscope to see them. And others, they can be over 2 feet long. Ascaris larva in the lung. So that's a type of roundworm. Ascaris, they're usually the really big roundworms. So the Ascaris nematode in the lungs can cause asthma and pneumonia-like symptoms. So a lot of times we used to think that fungus caused everything, and now we're seeing that actual worms can cause asthma also. They can cause a persistent cough, shortness of breath, wheezing, coughing up small amounts of food. And after about 10 to 14 days where they are in the lung, then the Ascaris, so they will be in a larva state, in the immature state in the lung. Then they will travel to the throat, they will be coughed up, and then they will be swallowed. Sounds disgusting, doesn't it? Ascaris nematodes in the intestines, that's really where they will develop as an adult. And they usually like to live more in the small intestine, not in the large intestine. And that's really important to know also when you're treating. So these are just a few symptoms that they cause. So vague or severe abdominal pain or distension, like your stomach is sticking out. You might not be pregnant as a woman and you feel like you're sort of like 3 months pregnant, or even a gentleman. You might have a stomach that's distended, and gas, abdominal pain. You can actually feel the worms moving. I personally in the past have felt them moving. It's such like a very subtle, it's almost like a little butterfly feeling in your abdomen, like in the lower. For me, it was always the bottom right-hand corner of my abdomen. And I thought, how am I ever going to get there? Like, because we didn't know about the parasite drugs years ago. We used ozone. You could get generators and do rectal insufflation, but it was like we would only use small amounts of ozone gas and it wouldn't reach that area. And it's like, how do you get them out? Well, these oxidizing enemas are incredibly helpful, plus the parasite drugs. So we'll talk about that in a few minutes. Constipation, they cause terrible constipation. Most of my students have really bad constipation and they have to use a supplement like oxy powder. Sometimes they have to use something stronger in order to get the bowels moving before we start treating. And it's really common. They can actually cause an obstruction, like a blockage in your intestines also. And when you start passing them, when they're really big, you can really understand how they can cause a blockage. And I have animals, like in my, in my 60s, I'm getting back into animals again. Like for example, with a horse, they can get colic, which is like an obstruction, and I'm just like, that's just parasites. And the way that we treat parasites in horses and animals and dogs, it's ridiculous. Like, we cannot pass worms in us. If we would just do one dose, it would be a joke. And for animals, I don't think we're really doing justice to them either. So diarrhea or bloody stool. So depending on the type of parasite, some will have constipation, some will have diarrhea. Some students will have alternating diarrhea and constipation. Feeling nauseous, kind of feeling like, oh, I just feel nauseous all the time. I feel like, is it my liver? Like, is there something wrong with my liver? And a lot of times, no, it's just that you're dealing with a lot of these parasites and the poisons that they produce. Vomiting, that is another one. Fatigue. Like extreme fatigue. It can be mild, but also really like the type of fatigue where you just want to lay down. You just can't handle life. Headaches, jaundice, weakness, muscle cramps. Weight loss is another one. You eat all the time and you just can't gain weight. I was like that as a kid. My mom would try to fatten me up, and my brothers and sisters would eat the ice cream and they'd gain weight, and I would never gain weight. And then vitamin B12 deficiency and iron deficiency. And some of you may have seen a visible worm in your stool. Like maybe you weren't even like treating or even thinking about parasites, and you saw this white thing in your stool one day and you're like, oh, that's really weird. I wonder what that is. I wonder if that's a worm. It kind of looks like a worm. A lot of people have told me that they have seen parasites in their stool when they were not treating. And these parasites, like the roundworms also, so it's not just flukes, but roundworms can infect liver, the different ducts, and pancreas. So the gallbladder, meridian axis, again, we talk about that. The gallbladder ducts, the liver ducts, like all in that area, they can get in there. And also they cause nutritional deficiencies, and that's one of the causes of disease. So if we're really deficient in iron or really deficient in vitamin B12, that is awful. Also, they can, the infected fertilized eggs, we can get them through contaminated soil, from animals, from other humans. We can get them, if somebody prepared our food in the restaurant and they didn't wash their hands, I'm probably just freaking you out, like I'm never eating out again. It's almost like it's better to eat warm cooked food in the restaurants where, people are not touching it because it's too hot. But the thing is, we can't avoid all parasites, and that is what we have to understand, is that we will be exposed to them. We can decrease our exposure to them. So if we do have pets, keep them out of your bed, absolutely. And for us, now we have dogs, but they're outside dogs. We're out a little bit of land, not much, but just the dogs, like the breed we have, they like to be outside, and so we still enjoy them, but I don't have all the hair. I don't have them stepping in stool and then walking in on the floor, especially if you have children that are crawling or they have toys on the ground, right? Think about all these things and making sure that you keep them out of your bed. I know that they're so snuggly because I love animals, but having them in your bed is not a good idea. And if you live in town and you have a small yard, make sure to clean up the stool regularly. Even with my horse, I definitely am picking up the stool every day, putting it in a pile, composting it. It gets really nice and hot. So management of parasites is really important. And then we have to live, right? Washing our hands really well. I wash at least twice. When I'm out with the animals and I come in, I wash at least twice, and I count to at least 20 seconds. I've heard, like the kids do ABC, they sing their ABC song until they're finished washing their hands, but I'll count to at least 20 seconds to make sure. And I will scrub under my fingernails. I've got like a little brush that I scrub under my fingernails. If you're using raw meat, like, because we love eating, animal protein, make sure to wash and disinfect things. If you're doing the enemas, the oxidizing enemas, make sure you disinfect the area really well. So you just have to think, and that's all that you have to do. You just do your best, and then you live your life, right? But just as we treat parasites in our pets, we should be treating parasites in us, right? Because we are exposed, whether we have a pet in the house or not, or have a dog or a cat or some other animal, we are still exposed to parasites. Like, you'd have to live in a bubble not to be exposed. Like, even if you're vegan and you don't eat animal protein, like when the produce comes in from other countries and they've used fertilizers that maybe has had, like manure or steer manure or, fecal manure that they have composted, maybe it hasn't been hot enough. So then you are going to be exposed to parasites on vegetables and fruit. It could be in meat, could be from eating out, could be on the shopping cart handle, could be anywhere. As if you like to garden in the soil, could be walking barefoot on dirt, right? I think it's the hookworm, like to grab onto the heel and bury into us through the heel. So it's just like you're probably gonna have nightmares tonight after what I've shared, but basically it's part of life. And it wouldn't be so bad, but our healthcare system not our doctors, but the system that we work under or that our healthcare system works with, they completely ignore this. They are completely ignoring all of these parasites that are in our environment. They're saying, oh, well, if you travel to another country, you could get them. But they are in our countries, or else we would not be deworming our pets, correct? Right. They're in our countries. So it's really important to do what you can to mitigate, and then we also treat periodically. But if we're really sick, we really need to treat these types of worms plus all the other parasites in cycles until we're well. So the testing is really poor. I've heard where I live in British Columbia, Canada, that when you do a stool test, they're not even looking for worms. I've had so many people that have shared with me that they passed a worm, and then they put it in their stool sample, and then they sent it in, and it came back that they don't have any parasites. Many people have shared that with me. Let me know if that is your case also. So the testing is very poor. You can do a comprehensive stool analysis. You can do DNA tests. Again, with DNA tests, they take such a small sample, whether it's blood, whether it's urine, whether it's stool, looking for various parasites. And it's so small that if there is no eggs or remnants or any DNA of these parasites in that small sample, it's going to show as a false negative. And that is typically the case. And even the very best parasitologists have said that our tests, the best ones we have, can pick up approximately 10% of the parasites that we have. So the vast majority of the parasites are not being diagnosed, which is really difficult. I'll talk about how we figure out a treatment plan. But so the stool, like the stool test can be inaccurate when they're trying to identify either the adults or the eggs. And some people have reported adult worms leaving their nose or their mouth, and occasionally larva has been found in sputum. So that's just gross. Adult worms may also be seen on a CT scan and ultrasound images, but really only by practitioners that are looking for them. So the vast majority of doctors are not looking for parasites. They don't believe you have them. They're just trying to give you a disease label, and then they can prescribe immunosuppressive drugs for that particular condition. The eosinophils are a type of white blood cells that are involved in going after these worms and these parasites, but they could be elevated in the blood. So if you have blood work done, you could see that you have eosinophilia, but in a chronic case, it is not going to pick up for sure. And so how do we treat these parasites, these roundworms? So today we're just focusing more on the large roundworms. And the way that we would treat these large roundworms is, and this is, I'm just going to talk from the experience of the Live Disease-Free plan that we have. So we started years ago knowing about fungus and MS and chronic disease. Then we learned more about the Lyme infections that are involved with multiple sclerosis, but also other chronic diseases. And then more recently, we've been learning more about the worms and the protozoa, and more in depth about the bacteria like Borrelia, etc. So today, talking about treating roundworms, what I can share with you, these are really important golden nuggets, is that somebody might use the oxidizing, or it's like an oxygen type enema, which kills parasites on contact with oxygen, and they might not notice a lot of parasites coming out. And so that is going to reach their large intestine, which is about 5 feet long. It's like an upside down U. And depending how far in that water reaches, the oxidizing water enema reaches, they will kill parasites. So for a lot of students, they start with small amounts and they may not notice a lot of parasites. Some people do. Some people pass huge clusters of like worms. And I know like one in particular, one student, I still remember the pictures, and he literally was walking without a cane for several hours a day by just doing 2 or 3 of these enemas. And so, you don't know until you start. You don't know what you're going to find. But if you're going to start with those oxidizing enemas, we start with small amounts of water because you don't want to kill off too many parasites too quickly, or else you'll feel like you have a Herx reaction, a Herxheimer reaction, a die-off, a little bit too strong. You might feel dizzy, you might feel really tired, you might feel like you have the flu. So that's why we start with smaller enemas. We release some stool, and then we hold that oxygen water in, and that helps to kill some parasites. So what we have found is that, some people will pass, but a lot of people won't pass a lot of parasites. And then they're like, well, is that normal? Because shouldn't I have worms if I have this disease? And then it isn't until they start taking the parasite drugs, because the parasite drugs are treating from the top down, and we're using a combination. Of course, we're definitely preparing before we start treating so that we can tolerate the treatments, because if you feel a little nauseous with these parasites in you, and then when you're killing them, you could feel even more nauseous. So and you could feel more tired, and you could feel more fluey. So that's why it's really important to do the prep work. Following the Live disease-free diet, supporting the body, having daily bowel movements, and sleeping at least 8 hours per night. That's the minimum before we start treating. We do have a checklist for healing. We do look at our blood work. We support our physiology. Any areas that need support, we do some cleaning up in the environment, decreasing mold and wireless radiation. So we do a bunch of prep work before we start treating. So our students are feeling a lot better before they start treating. So then once they're ready to start treating, they can start using herbs and the oxidizing agent orally, and the enemas they can start right away, like right at the start when they're just following the diet and supporting the body. But once they're ready to start treating, this is where they will get samples of parasite drugs, and they'll be energy tested. And at this point, we still find value in energy testing. So this is where you take samples of commonly prescribed parasite drugs, like you just need 1 dose, and the practitioner, a healthcare professional, that like a chiropractor or naturopath, they're going to use the fact that we all have an energy field around us. And when we're sick, when we have toxins and infections, our energy field is diminished a bit. And so as you bring in the right treatment, then people find that, or when they're testing you, they find that your energy is restored or balanced. And so then you can get an idea of like which parasite drugs test well for you versus trying to figure out what parasites you have, because that ain't going to happen anytime soon. Unfortunately, it's not that I'm aware of. So, but the energy testing is not an exact science. And this is where you really have to use other criteria also to build your game plan. So we use our health history, the health history of our parents. We use our diagnoses, our symptoms, also what we're passing when we're doing the CD enemas, what it looks like. I'll show some pictures to you in a few minutes. So all of that we see before, and then the energy test results. So there's about 6 criteria. And if, like, we just had one student where she went to I don't know if it was a naturopath or a chiropractor, and he said, no, you don't test well for any parasite drugs. And she has chronic disease. And it's like, that's not possible. Then you have to get a second opinion. You want them to be blind. You want them to not know what they're testing. They shouldn't care. It's like, yes, this one tests well. No, that one. And I don't care what it is. That's how they should view it. And some people or some practitioners are a little nervous too. And so they might say, no, you don't really test well for anything. And then obviously you need to get a second opinion. But most practitioners are pretty good and pretty helpful. So then we look at all those 6 criteria, and does the energy test results kind of confirm with what other students have used to recover, like what you're passing, what types of parasites you're passing? Yes. And then the students bring me the list and bring their doctor their list, and then they're able to get prescriptions for the parasites that they test well for. So the key is that if you just take one, so I'll tell you some of the names of some parasite drugs that are helpful for treating these roundworms. So mebendazole, albendazole, ivermectin, nitazoxanide, which is also called Alinea. So these are all different parasite drugs, and there are others. There's fenbendazole, I'm pretty sure that does roundworms also. And so there are other. Praziquantel is very helpful it's kind of like just making the others more effective. we know that albendazole and ivermectin is quite a winning team. It just makes the treatments more synergistic, like stronger, more effective. And I don't mean stronger as far as you feeling worse, but just a better killing effect when you have albendazole and ivermectin together, if you test well for it, right? That's the key. So albendazole will work more systemically, whereas mebendazole will work more just in the gut. And there's also pyrantyl palmitoate or combantrin. The brand name is combantrin, but it's pyrantyl palmitoate. So mebendazole and pyrantyl palmitoate, they will work more in the gut and they will not work as systemically. So if we have neurological conditions, then often we find more value with albendazole because it does cross the blood-brain barrier, and that can be helpful and or work more systemically. But it does require, and a lot of these parasite drugs do require that we have a lot of fat with our meal so that they're absorbed better and that they will work better. So at least 4 tablespoons of fat with your meal. And ivermectin can make your eyes kind of go wonky. That's something to know about. And it's usually due, from what I've been told from pharmacists, is due to having parasites in your eyes. And so this is where you work with your practitioner and you use an amount that is not going to be giving you very strong symptoms. So with treating parasites, it's really important that you listen to your body, right? It's very important you never push through if you don't feel well. So if for some reason you took ivermectin and it just made your vision like really wonky, then don't take it anymore. Stop and recover. It takes 1 to 3 days, and then talk to your practitioner. So everything I'm sharing with you is for educational purposes. It is not intended to treat, cure, mitigate any disease. You deal with this with your doctor. I'm just giving you some wisdom that you can talk to your doctor about this, right? You need support if you're going to recover from a parasitic infestation. You really need support. It's not safe to just play around with drugs and try different amounts and dosages, and you're either going to make the parasites resistant and then that drug isn't going to work for you in the future, or you can hurt yourself by taking too much. And we have not found that one parasite drug treats these roundworms. We're using a combination of at least 3 or 4, and we're talking about the large roundworms, and you're going to see pictures of them in a moment. So these are anywhere from up to a foot and up over 2 feet long. So just one parasite drug has not been helpful. And also, without doing the enemas, we have not found that that is extremely helpful either. It's really, the enemas are super, super helpful, like incredibly helpful. So ivermectin, again, like if you're going from dark room to light room or light to dark, you might notice like shooting stars for a few seconds or a little bit of waviness, but it should go really quickly. And you should notice that that improves in time as you're doing treatment cycles with less parasites in your eyes. So ivermectin will treat parasites in the eyes also. But sometimes we might have parasites in the eyes that are really not treated well by ivermectin. And so sometimes we call it an angry worm syndrome or an angry parasite syndrome, where the parasite is kind of being like annoyed or aggravated by a treatment that's not really effective enough to kill it. So either way, it has not been an issue. We haven't had any students that have had issues with ivermectin, but listen to your body. And if anything is too strong, stop and recover. And it might be that at your body weight, you might do smaller doses per day until you tolerate it. And that's another important thing, is that our students are introducing the drugs one at a time. They've done a lot of prep work. They're feeling a lot better. If they test well for 3 or maybe 5 parasite drugs, which is really common, they're probably not going to take all 5 on the first treatment cycle at the same time. They might take 3 together that we know are tolerated really well, introducing them slowly one at a time. And then they'll take the second 2 and they're going to, introduce them one at a time slowly. And then if they know that they tolerate them all well, then there is really a huge benefit to using, 3 to 5 parasite drugs at one time as far as treating these very large flukes, tapeworms, and roundworms, like the big ones. So at least like 3 or 4, it's hugely helpful, especially for these ones that are a foot to 2 feet long. All right, and then the oxidizing agent, that is, and I can't say the name of it here because I will have my video taken down. So you can go onto livediseasefree.com and you can look at oxygen therapies and treating parasites. You can learn about it. And if you connect with us on Live Disease Free, put your name and email, you'll know when I go live, you'll know when I have these classes. You can watch my masterclass training to see all the steps we take to recover, and you will be able to have be more knowledgeable with all the research that I'm doing. And so the oxidizing, I can't remember what I did, oxygen therapies or oxygen, I think it was oxygen enemas maybe that I also did. So you can do like oxygen enemas for treating parasites, live disease free, or oxygen therapies for treating parasites. And so you'll see a blog post on our website, livediseasefree.com, with a video that's shortened, edited, and there you can learn about that oxidizing agent. And if you're connected with us, then we often share, information about it, like some of the documentaries, that so you can understand how safe and helpful it is. Everyone should know how to use it. It is so cheap and it is so helpful, really important. So again, if we just use the parasite drugs, and even 5 at a time, I've done this myself. So I tested well for 5 parasite drugs because I'm not as burdened with parasites as if, let's say, I was dealing with MS like 35 years ago. So I can tolerate taking them all at the same time. So taking 5 parasite drugs 2 or 3 times a day at the recommended doses for a full week, and then doing the enemas and seeing those big worms coming out then. So they were still alive. They were probably suffering. They probably moved out of the small intestine and moved into the large because they're moving away from the poisons, the parasite drugs. But then once they're in the large intestine, then you can hit them with an oxygen enema. So this is not the same as a coffee enema. We don't do coffee enemas because even decaffeinated coffee will stimulate parasites. We don't want to stimulate them. So these oxygen therapies, they do so much more. And of course, yes, we do need to fertilize and promote the health promoting microbes as we're treating, but there's no other way. We have to get these big parasites out. And another big thing is to treat long enough. Like if you start passing them and you've done it for 3 cycles and you're like, well, I don't see any more worms and I'm probably like 95% better, you have to make sure you treat long enough because remember I said 200,000 eggs in a day. And so there are larvae, the immature form in your body, and there are eggs that are dormant. So you have to give them a chance to hatch and then hit them again, hatch and hit them again. So make sure that when you're working with your practitioner that you don't stop treating too early. And there is this really wonderful neurologist who's really been helping to create awareness. But what they're saying is like, oh, there's a mother worm that you have. And that has not been what we've seen. We've seen in our students that when they're really sick, they can have 100 worms, and maybe they're not all over a foot long. Maybe some of them are 6 to 8 inches. Maybe some of them are intestinal flukes or other flukes. Could be, I don't know if the blood flukes, you'd see them as much in the intestines, but for sure intestinal flukes. So that's not what we're seeing, is just having one mother worm and that takes over. And our students are passing multiple large worms. So the oxidizing enemas are incredibly helpful. We would not have the success that, like, when you are treating with the parasite drugs and you can use some herbs and then you add in the CD enemas, it is literally mind blowing. That's what one of my most recent students just shared this last week. Like, she doesn't have chronic disease yet, but she was in bed in August. She's just suffering, just heart issues, cognitive, extreme fatigue, just weakness. And she is passing so many worms. And of course, she has been using some of the parasite drugs, but this is a golden nugget I'm giving you right now. After her naturopath gave her one parasite drug for maybe 2 or 3 weeks, and then the other parasite drug just kind of like 1 or 2 doses, and that, kind of thinking, well, the parasites are getting weaker and we'll just hit them with that second one for 1 dose. She like she did that and then finished that. And he said, you're clear. I don't pick up the parasites anymore in you. So this is what happens, is that we get the wrong information and then we think we're clear. But then she came to me and she's like, okay, I've been in emergency several times. I've been to the naturopaths. I've got a cupboard full of supplements. I've tried deworming and I need help. And so I said, you'd always do the same thing. Get your carbs down, support your body, and start treating from big to small, and start with the enemas. So because she just finished those parasite drugs, so she did the enemas and she passed a 24-inch worm, 12-inch, not 24. That was another student. So she passed a 12-inch worm and a bunch that were similar, probably 8 inches or more. And her mind is blown. And and this was just like not even a week of just doing the enemas. Now she's back on treating again because she had a break week. But she's like, my mind has been blown. I'm actually having times where I'm feeling like my old self, where I have energy already. And that's been maybe a week at the most. And it's just shocking. And she's like, she can't believe how many worms are coming out of her. And she does not have a chronic disease label. So she said, like, how many people need this? There's so many people that need this, that are just suffering so terribly. She was mentioning another person that has Lyme disease and he's just wasting away. He has he's just underweight terribly and he thinks it's all Lyme disease. And then you get treated with antibiotics over and over again. And you've got all these other worms that are not being treated. And I'll show you what came out of a Lyme patient. I've got to speed it up a bit here. There's a lot to share. So intestinal obstruction is another one. So the Ascaris larva, so the immature form in the lungs, they might require us to have bronchodilators or corticosteroids like we would do with asthma conditions, iron and B12 deficiencies. So we might need supplements for that. Pain relievers, anti-inflammatories, like histamines. I had one student that didn't have chronic disease, but just had she has a very happy life, but she just felt so sad a lot, and could cry on a dime, and had a lot of gut issues, lived on a farm, and she just started treating and doing the enemas, and the big roundworms that came out of her were crazy. She had a lot of allergies too. And so her allergies were reduced by a half with just maybe the first treatment cycle. And she had allergies all her life, like really bad allergies where she had to live on antihistamines for certain periods of the year. So let's go. Do you guys want to see some pictures? Do you think you can stomach a few pictures? All right, let's see if you can. I'll share some pictures with you here. Okay, so these pictures are for educational purposes. It's really to help you to see the types of worms that could be in you. And unfortunately, that is the case for a lot of us. So I don't think I can put myself on the screen here, but I'd be in the middle of the pictures anyhow. So I just want to make sure that you guys, can you see the pictures? Let me know if you can see them. So again, these are just a few pictures of roundworms that our students have passed, and they're actually pretty clean. So a lot of people say like, oh my gosh, does it hurt when they come out? And that's just so disgusting. So it doesn't hurt at all. And yeah, it is disgusting to think that they're living in us, but it's so incredibly exhilarating to go, that's why I felt so horrible. I cannot believe that was living in me. So this was somebody years ago that was recovering from MS. And this is another student that has been MS free for several years. And so this was one worm that she passed. And so there's multiple worms that they pass, but I'm just sharing with you a few so that you can see, yeah, you can see the pictures. Perfect. So you can see how, what to look for. If you are working with your practitioner, if your practitioner is willing to help you, you want to know what you are going to be looking at. So if you do one enema with this special oxidizing agent, let's say you do it in the morning, and then you do another one the next morning. In the first water that you release, it's usually fairly clean, and that's where the dead parasites are. So some people will put a colander in their toilet. Some people will put just a ice cream bucket or something, or just catch, or a smaller plastic container, just to catch some of the water with the dead parasites in it. And some people will just maybe release some of the water, the oxidizing agent water, into the toilet, and they'll have some forks and they'll pull the dead worms out, and they will lay them on, like, I would not do, this was in the early days, where they would lay them on toilet paper because that just rips them apart. Lay them on tin foil or parchment paper because that way they don't fall apart. And this is really important. You need to document the parasites you're passing. You need to put a ruler or a tape measure beside them so that the doctors can see, your doctor can, your naturopath, whoever's helping you, can see what you're passing, and they can tell how big they are. So you can tell with this because you can tell how big the tiles are on her floor, but otherwise you wouldn't know if that's a 5-inch worm or if that is like over a foot, and that's definitely over a foot long. And so here's another one. And so again, I believe that this parasite was passed. So a student did a really wonderful blend of herbs, parasitic herbs. Like there's probably like close to 10 herbs in this mixture, like very good blend of herbs for treating parasites. And he did pass some worms, but it wasn't until treating with the parasite drugs that the really big ones started to come out. Let's see here. There we go. And here's another one. So they're pretty disgusting, aren't they? And more. Here's another one. So those are more in. So this one is really big. So this one would be over 2 feet long. And that would be, I would assume that that is an Ascaris worm. But we're going to, it's been really hard to try to get doctors to, or not doctors, but even parasitologists to help us figure out what they are. So I'm working on different, like connecting with different people in the world that are parasitologists and seeing if they will help us identify, because we've got really nice pictures of a lot of these worms. And I do have some video footage too, and from students sending in video footage so that you can see that this is not slime, that you lift it up with a fork and you wiggle it around and it holds together really nicely. So all of that stuff is really important to document for doctors and for healthcare professionals and for researchers, because otherwise they just don't believe that we have this issue. I'll go to your questions in a minute. Just a couple more pictures. So here's another huge one and another small one. And this will all be video, and you'll be able to look and go slowly and make the pictures bigger. Another one, and this is, so this is a student that is, let me just see, did I pass? Yes, that's still MS. So this is a student that does not have multiple sclerosis, but a student that has another inflammatory demyelinating disease. And she is the one that said she's passed at least 200 worms in 3 treatment cycles using multiple parasite drugs. So again, when you're treating, you have to work with someone. And if you can't find someone, that's what we help students to find, all the resources they need and the help in the Live Disease-Free plan. And then this is one of our students that had Lyme disease. So this wonderful student did not have MS, but she had worked with Lyme literate doctors, and she was really, really sick. I'm sure she had been on antibiotics and she just wasn't getting better. And then it wasn't until she started treating the bigger worms, and she passed a lot of these worms. This is just one of the worms that she passed. But that was what made the really big shift in her health, was when she started to pass these very large roundworms. So today we're just talking about the roundworms, but remember, we're going to talk about the intestinal flukes. They're maybe even more inflammatory than these roundworms. But I can tell you personally, and our students, that when they do pass them, they notice huge improvements in their heart, in their cognitive function, like mental clarity, in feeling happier, in strength in their legs. Their restless legs go away, spasticity goes away, like all of these symptoms. And so MS is an infectious disease caused by a parasitic infestation, and a lot of our students have a lot of large roundworms. All right, I'm going to go back to showing the other screen. So I'm going to go over a few of your questions. So Sherry, you can't you get medication for roundworms over the counter at Shoppers? So you can get, there's usually like in countries, there's like mebendazole or there's pyrantel palmawate, depending on what country you live in. But they're more for treating like pinworms. You can go to the health food store, you can get different blends of herbs like black walnut and wormwood, and cloves is a common blend of herbs, and you will probably pass a few worms, but we have not found that that is going to help people to recover from chronic disease. So again, the really big worms are not coming out with just that. We definitely need the enemas, and we need a combination of 3 or 4 drugs at least, that it really helps to get the big ones out. Otherwise, they don't come out. They are just, and even just with, like I said, I took 5 parasite drugs for 7 days, like 5 of them 2 or 3 times a day. And day 7 did the CD enemas, and that's when they came out. And it's not like they were dead living in me. It's like that's what hit them, because they were then in the small intestine, because you can't do an enema that will reach the enemas will not reach the small intestine. They will only reach the large intestine. So I was only able to reach the large intestine, but they were there, and I was able to kill them, finish them off, and get them out. But then you have to do that over multi-cycles. And so are the drugs prescribed? It is most important to work with someone, because again, it's like, what is your goal? If you, once you know these parasite drugs and you've used them before and you know how to take them and etc., then that's a whole different thing. But when you are really sick and you're really infested and you don't have any experience and you don't really know what you're supposed to take, how much you're supposed to take, you can't do this on your own. It's not smart to do it. And just, there's people out there that are on forums and they're like, oh, try this and try that. And I know one lady, she took way too much ivermectin. She ended up in the hospital. Luckily, it's not a really toxic drug, but it's still like you could really hurt yourself. So I would personally say, Jose, like how much and how often you take the parasite drugs that you test well for. But again, based on those 6 criteria, like what you're passing, what your symptoms are, maybe you've had parasites in the past, like all of these factors we take into account, what your diagnosis was, what your health history, your parents' health history. And so that helps us to determine which parasite drugs. It's usually 3 to 5 parasite drugs people test well for. And then they do cycles until they're well. If they've been sick for years, they might do a year to a year and a half of cycles, and they're about a month long, where you're doing, let's say, 10 to 14 days of treating the bigger parasites, and then you're knocking back fungus, and then you're taking a break week. But during the break week, you're still treating, you're still keeping the pressure on, but you're just hitting different, maybe the smaller parasites and not with drugs. So we do multiple cycles. And again, it's like if somebody is not really sick, it might be 3 to 6 cycles. If somebody's been quite disabled, it might be a year to a year and a half of treatments, but it really depends on the person. I've had like one student, by the end of the class, she was out of her scooter, and she had been sick for 5 years using a scooter. So I can't even guess, because it's like how well we implement, how well we get ready to treat, if we're using the right treatments, if we've done the prep work so that we can treat more aggressively, if we're able to use the enemas. Like a lot of people can't use the enemas if they're really disabled at the start, but they're finding other creative ways to do the enemas. So when you do all of that together, plus we do use herbs too, that's where the magic happens. So like that one young person she's around 40 years old, like within a week, going from basically often being in bed, not being able to care for her family, and just not knowing what is going on and it's affecting her heart, to actually being able to function in the world in a week's time. Like that's crazy. And that's just with a little bit of coaching, with a little bit, like her naturopath told her, you're clear. Could you imagine if she would have believed that, and then she would have just carried on, and she would have been back like full-time bed again after that first treatment cycle that helped her a little bit, because she's passing a lot right now. So you would do multiple treatment cycles, and then once you're well, it's really important, just like we do with our pets, we should deworm ourselves at least, I would say, minimum once a year. I would probably say twice a year if you've had a history of a parasitic infestation. And you listen to your body, right? Like if we could go to our doctor and say, "Doctor, I'm not sleeping well. I wake up through the night. I'm having a hard time falling asleep. My allergies are acting up. My stomach, like I'm dealing with some gas and constipation, feeling a little bloated, just a little foggy head." He'd be like, "Oh, sounds like you have parasites. Let's test you. Let's treat them right away." And then we would never have chronic disease. We wouldn't have all of the autoimmune diseases. We wouldn't have cancer. We wouldn't have heart disease, you name it, we could avoid, and that would get rid of our multi-trillion-dollar industry. And we wouldn't even really need vaccines, because when your microbiome is in balance, you find that you don't get the viruses, and if you do, you can handle them a lot better. Like with the COVID, when people got COVID and then they had a huge parasitic infestation, that really was hard on them. Metronidazole is something that's used more for treating the smaller parasites, so not really the worms. And that's a strong antibiotic parasite, so that's not something that we like to use very often unless you have to. It's like a very strong antibiotic parasite. So I personally would not. I would definitely, it has to be supervised with a doctor. And then Jose, you said you take copper water too. I personally don't do things like that. Like this is where, your body doesn't want too many of any kind of metals, and you have to be really careful that, like, even silver is relatively safe, but it can make your skin turn gray or kind of a blue hue to it. So if that's the only thing that would help you to live, like if you're going to die and you had to take it and it's safe, then take it. But if you don't need that, and that's not what you're deficient in, then this is what everybody does. They're just like, try this supplement, try that supplement, try this mineral, try that. And it's like a fortune. And then 5 or 10 years later, you're bedridden because nothing really made a difference. Like nothing really makes a difference until you get these worms out of you. What are the best treatments to treat roundworms? So I mentioned those, Sasha. And one more question. Oh, thanks, James. Thank you so much for your kind words. Awesome. So I think that is it. I'm just going to check here to see that's all the information that I wanted to share today. So we're getting to the end of the year, right? You guys had your Thanksgiving, or you're having your Thanksgiving in the United States this weekend. And I hope you guys have a wonderful Thanksgiving. But I want to ask you, like, what do you want 2025 to look like for you? Do you want more of the same? Or are you at the place where you're like, if I have any of these worms, they need to come out. I need guidance. I need direction. My doctor might write a prescription, but he really has no idea how to treat these parasites. So that is why it's really important that you take a different path. That's what I did. And that's why I have been able to live MS-free for over 35 years, because early on I decided not to follow standard of care, which gave me no hope for a cure. I decided to, and I didn't know that it would end up like this. I didn't know we would learn all of this. Again, it's by the grace of God, but it's been through a lot of research, a lot of hard work, a lot of diligence, and then a lot of experiences that we've learned from our students as to how to treat these parasites. And we're learning more, how to do it more quickly, how to do it more effectively. And that is why that one student who's 40, who doesn't have a disease, how she's been able to just turn her health around, not totally out of the danger zone, but marked improvement in a week. That's crazy. And what's coming out of her, she's like, my mind is blown. So if you're at that place where you're like, this is new, check it out. I've got lots of videos on our website and articles that I wrote on our blog post, livediseasefree.com. Watch my masterclass training if you want to know all the steps we take to treat these infections, because it's not just roundworms we've got all kinds of other parasites, and that's what we're talking about in this series that I'm doing for you. But very important that you watch my masterclass training if you want to know the steps. And then if you need support and you're ready, you want to make 2025 your very best year because you want to treat these critters and get them out of you, then make sure to watch my masterclass training, fill out the form, book a time to chat with me, and you can become a wellness champion. We just had a whole bunch of new students join our academy program, and I'm so honored. These ladies and gentlemen are very smart because they are setting themselves up before the holidays so they can get through the holidays, feel better over the holidays, and start 2025 running, which is so awesome. So with that, I'm going to let you guys go. Please like, share, and subscribe if you appreciate all this work, all this research that I'm sharing with you. If you want to help us bring change, please, that helps it to get out to other people so that YouTube and Facebook will show these videos to other people that are searching for answers. Like, share, and subscribe. Otherwise, have a wonderful Thanksgiving weekend, and we will talk to you next week. Take care and bye-bye for now.